Welcome to the only patient advocate podcast you'll ever need. In this podcast, you'll learn how to advocate for yourself and your family, and where to turn when if that becomes overwhelming. Now, here's your host, Joyce Schulz-Killian, registered nurse and owner of At Your Request Patient Advocate, LLC. She is your private patient advocate. Here at your request to communicate, educate, and advocate with and for you.
Hi, I'm Joyce Schulz-Killian, a registered nurse for 27 years and in healthcare since I was 18 years old. I'm the owner of At Your Request Patient Advocate, LLC. I'm here at your request because I am your private patient advocate, helping you navigate healthcare one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm hoping to give you the tools you need to be your own best private advocate. Find me on Facebook at Your Request Patient Advocate and on Instagram at JSKICURN, and on Twitter at RN Advocate, the number 4 and the letter U, and on YouTube at Your Request Patient Advocate. Hit like and subscribe if you like what you hear, and tell a friend. Today I wanted to give an update on COVID-19. It is August 10th, 2021. It is a Tuesday, and I was on Facebook and I read a post by a friend of mine and colleague who is a nurse practitioner for an infectious disease doctor, and she posted about losing a 20-year-old patient yesterday, and my heart just sank. I'm not quite sure what is going on, but I was always raised to believe that we should listen to facts and science and trust medical personnel. I'm a patient advocate and I question medical personnel every day. I get into conflicts with them. I question the viability of something or what the procedure for something is. I am constantly watching people and remembering basic techniques for things and watching techniques be broken and pointing it out to people. That's my job. As an advocate, sometimes I have to tell people what they're doing wrong and point out their mistakes. And that's not an easy task to do. But with COVID, I haven't found that I've had to be able to do that. I'm starting to get nervous again. I have my alcohol bottle in my car with my 100% alcohol in it. It's a spray bottle, and I'm spraying my hands. I'm still wearing a mask. I let down for a while my guard, but with the Delta variant out, I don't feel that I can let down my guard anymore. I am fully vaccinated, have been since February, late in February. I feel very confident in the vaccine. People are questioning the vaccine credibility because it was released so quickly. You have to realize we are in 2021. We are in an age of technology where we just recently had 2 people go into space. When I was 5 or 6 years old, a man walked on the moon. I can't imagine thinking that lay people would ever be going into space, but they are. So technology is very advanced, and the way that they made this vaccines are with RNA and DNA factors. So they had the information of the correct line of RNA for these vaccines, and all they had to do was find the connecting piece to disarm it. So it's kind of like a lock and a key. They had the lock, they just needed the key to fit in to disarm the vaccine, to disarm the virus. And so they found those, and we have Pfizer, we have Moderna, and we have Johnson & Johnson. My sister just recently asked me, she's getting AstraZeneca. She lives in the Bahamas and was asking me about that, so I did some research on AstraZeneca for her. And my advice to her was, it's a vaccine, get the vaccine. I remember when I worked in the hospital, we had methicillin-resistant Staph aureus, MRSA, and it was first coming out then, and it was very prevalent. And the guidelines said that we had to reach about 70% of people having MRSA to not have to isolate anymore. Then it's what's called, it had herd immunity, or not herd immunity, but it had community a potential, and it had gone into the community, and 70% of the people, when they were positive with MRSA, we wouldn't have to isolate anymore. I don't know that we've ever gotten to that point. I don't work in the hospital system anymore, but I remember that, and I remember that number, and it's the same with vaccines. We need to get to about 70-80% of vaccinated people to be effectively ward against this virus. If we don't, the virus still has a chance, and what can happen is it can mutate, kind of like a resistant Staph aureus. A resistant Staph aureus came from, and resistant bacteria comes from people who start an antibiotic and they don't complete it. They don't finish it completely because they feel good after 1 or 2 days and they stop taking their antibiotic. So the bacteria has a chance to mutate and change and become resistant to those drugs that normally would have helped it. That's what's happening in COVID, is because we didn't reach that 70% of the community being vaccinated by a certain time frame, and there are people, lots of people, that still are not getting vaccinated, questioning it. And we have a whole population that can't be vaccinated. Children under 12 can't be vaccinated. So for us to protect them, adults have to be vaccinated, and majority of the population has to be vaccinated until the vaccine can show that it's effective in children and doesn't have any side effects. And they're still testing that. So again, I am going to encourage everybody, drop the conspiracy theories. If the government wanted to do something to you, don't you think they'd hit up the local McDonald's or the local Burger King? Because that's where we're all hanging out at. We're not hanging out at the vaccine centers. So I just think if the government wanted to pull something over on us, they wouldn't do it in a vaccine or by mandating a vaccine. We are in the midst of a pandemic, and now we're in round 3 or 4 of this very deadly pandemic that's already taken 600,000 United States citizens. That's no drop in the bucket, if you ask me. And now it's affecting our young people. The COVID vaccine is not available to people 12 and under, not yet. Let's all get vaccinated. Drop the conspiracy theories. There are no conspiracy theories. This wasn't created to do anything to the public. It wasn't created. It just happened. Pandemics happen. Viruses happen. This virus is changing. We now have the Delta variant, and that's a pretty bad variant. It is, from my understanding, 5 to 9 times more transmissible than the original COVID variant that came out, COVID-19. Which means it's like chickenpox. It can be spread just like chickenpox, as quickly as chickenpox. So again, I'm wearing my mask. I'm doing my hand sanitizer. I'm one of the only ones in the stores that's masked. Not really, but it's true in some respects. Some stores I go into, people are masked more than others. But don't take this virus for granted. Yes, getting the vaccine will most likely keep you out of the hospital. If you were to get the virus, it doesn't automatically stop you from getting the virus, but because you have immunities built up, your body is better equipped to fight the bacteria, the virus in your body and overcome it. So we have that chance right now. If you're vaccinated. If you're not vaccinated, you're playing with no deck of cards at all. And people have been put into the hospital. Children have been ventilated. People have died. A 20-year-old died yesterday. Just got his vaccine the week before, was sitting on the fence about it, decided to get it, but it was too late. That's all I'm going to say about the COVID-19 and COVID-19 variables. I just wish everybody would stop with the conspiracies. This is not a political thing. This is about public health. Wearing a mask is about protecting public health. We have an obligation to our community to protect them, kind of like TB. There are reportable diseases that we still have to monitor so that they don't get out of hand. We haven't had a smallpox, outbreak in years. I carry my smallpox vaccine scar proudly on my arm, and I wear it proudly because I know my children didn't have smallpox or didn't need to get the vaccine. So, again, please vaccinate your children if you can, 12 and over. Adults, get out there and get vaccinated. If we need a booster, that'll be determined later, kind of like a flu shot. Get your flu shot. One of the things that happened with the COVID virus is because we were all wearing masks, washing our hands and using hand sanitizer and not hugging and spreading germs like we were, was the flu went down drastically last year. Let's see that happen again this year. Let's stop this variant. Let's stop COVID-19 in its tracks. Let's stop this virus now. On that note, I'd like to thank everyone for listening today. If you like what you hear, please hit like and subscribe. I know there's a lot of people who don't like me talking about COVID. And tell your friends. I would like to thank everyone who helped me to take the plunge into this podcast and with all my dreams I've had in the past 8 years. Remember, I am your private patient advocate, and I'm here at your request to help you navigate the healthcare system one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm here at your request because I am your private patient advocate. Find me on Facebook at your request patient advocate, and on Instagram at JSKICURN, and Twitter at RN Advocate for You, and on YouTube at your request patient advocate. Hit like and subscribe and tell a friend if you like what you hear. Thanks and have a great day.